is a paper recently presented at the AATS meeting last year, and now accepted in the seminars of thoracic cardiovascular surgery. And it is a multi-center investigation with the aim to assess the real world incidence of adjuvant chemotherapy following lung resection. So these are patients who have pathologic N1 or N2 disease following a lobectomy or pneumonectomy, so who are candidates to systemic treatment after surgery. And we found that basically only less than 60% of these patients were able to start chemotherapy after surgery, which is a very low proportion of patients. This is a very crucial information that basically changed our practice in our MDT here in Leeds, for instance, where we were a little bit more liberal in offering surgery upfront for single station N2 disease in patients fit enough to undergo surgery. But now, realizing that, then a very low proportion of this patient after surgery will be able to actually start chemotherapy, basically prompted us to change practice and to offer neoadjuvant chemotherapy instead before surgery, to ensure that these patients receive all cycles of chemotherapy, systemic treatment they need. And also we found that specific group of patients, specific factors are associated with this ability to receive chemotherapy. And we have found that, for instance, age is a crucial factor. So elderly patients are less prone to receive, or they receive less frequently chemotherapy afterwards. A low body mass index, which reflects frailty. A low FEV1, which is, COPD, means COPD, poor pulmonary function, and then poor performance status, and pneumonectomy. The extent of disease, these patients very infrequently are able then to receive chemotherapy. For instance, a patient, a 75-year-old patient with low DLCO, undergoing pneumonectomy, with a performance status of 1 and chronic kidney disease has a probability of only 6% of receiving adjuvant chemotherapy. That's just an example. So it was a very important study, which we think support the concept of the importance of fitness when deciding the timing of chemotherapy before or after surgery. And in patients unfit or elderly patients, or those in whom an extended resection is anticipated, neoadjuvant chemotherapy should be administered instead of adjuvant, to ensure that this patient receive the systemic treatment they need.